Hello everyone, welcome to our channel. My name is Zetu. Today I would like us to talk about craniotomy. What is craniotomy? Craniotomy is the surgical removal of the part or portion of the skull bone. Neurosurgeon will remove that skull bone temporarily just to get access into the brain and treat any condition that needs to be treated surgically. After the procedure, the portion that has been removed will be replaced to its position. What is a skull? The skull is a skeletal framework of the head. It is formed from the bones that are fused together, and those bones are parietal, frontal, temporal, or occipital, just to mention a few. The function of the skull is to protect the brain. Why craniotomy is performed, or what are the indications for craniotomy? There are quite a lot of indications for craniotomy. To mention a few of them, craniotomy can be performed to resect or remove the brain tumor. Another one, craniotomy can be done to drain the brain abscess. Another indication, craniotomy can be done to do the evacuation of the hematoma. Craniotomy can also be done to insert a hardware, for example, shunt. Craniotomy can be done to clip the aneurysm, ruptured or unruptured. Aneurysm is the bulge or ballooning in the blood vessels that can rupture at any time. Once somebody has been diagnosed with aneurysm, it is an emergency craniotomy that needs to be performed so as to clip that aneurysm. There is quite a lot of indication of doing craniotomy. Craniotomy can be done as an emergency surgery, or it can also be done as an elective surgery. In case of clipping of aneurysm and evacuation of the hematoma, that surgery will be done as an emergency surgery. Even if it's an emergency surgery, there is a lot of tests that needs to be done immediately so that the surgeon will actually know where is the problem, in which part of the scalp is the problem. In elective surgery, if they are going to do resection of the tumor or insertion of the hardware, and those type of surgery is done electively. Craniotomy is a major operation, therefore the patient needs to be prepared pre-operatively. There is a lot of tests that will be done so that the surgeon will know the location of the tumor, or they know where is the problem, and that will also help them during the time of surgery. In elective surgery, the patient will be prepared pre-operatively Explanation of the surgery will be done by the surgeon concerned, and the patient will be educated what to do pre-operatively and what to do or what to expect post-operatively. Quite a lot of tests will be done. If the patient needs to be referred to other specialists, the patient will be referred to those specialists. Whatever problems that needs to be sorted prior the operation will be done to make sure that the patient is fit for surgery. Patient will be admitted into the hospital. I'm talking about elective surgery here, will be admitted into the hospital and will be prepared in the hospital, and then the patient will be taken into theater. When the patient is taken into theater, there is a lot of preparation that is also done in the theater. There is quite a lot of team that needs to assess the patient. The anesthetist is another team that is involved, and there are other people that will be working with the surgeon that will be doing some other tests while the surgeon is operating. All those teams need to be ready so that the operation will go well. Once the patient is in theater, it's done under general anesthesia, but you can do craniotomy, awake craniotomy, but in other cases, it's usually general anesthesia. And the surgeon will start the operation with the help of the other teams that are a part of that operation. Once the operation is finished, it depends what has been done onto that patient. In operation, like major operations like tumors, like aneurysm or like tumors, the patient will be taken into ICU and the patient will be monitored there until it's transferred into a neuro section of the hospital. And some patients, like if the patient can be recovered in recovery room, the patient will be taken into recovery room, and then the patient will be monitored there, and then the patient will be transferred into neuro ward. It is important for those patients to be nursed in neuro ward because the staff in that area will know exactly and they are trained what to do. They will be following all neurological observation where the patient will be asked some questions so that they will make sure that the patient is orientated with the surroundings. The patient will be asked to move the arms, to move the legs. The pupils will be checked, and all that is important so that the patient knows that is in a safer place. It is important for the team to do all those neurological observations so that they can detect whatever problem that can follow immediately after surgery. It depends what operation has been performed. Some patients can be kept in the hospital for some days, sometimes 3 days up to 7 days. And once the patient is ready, the patient will be discharged home. It is important for the patient to know what to expect even at home. The patient needs to be informed that he has to take it easy, whatever he's doing. Patient must follow the doctor's orders. Rest is important so that the patient, that will help towards the healing of the patient. Patient will be prescribed with medication, and some medication will be steroids that will help to reduce the swelling. He will be given something for pain that will help the patient whenever he's having pain. Patient needs to be educated to take a balanced diet that is going to help towards the healing process after surgery. If the patient has been a smoker, it is always advisable for the patient to quit smoking. Alcohol is another thing that needs to be taken into limitation because while the patient is on recovery period. It is important for the patient to know what is expected, what part as a patient that can also play. A follow-up, it's also important. Patient must be informed that he must follow the follow-up and follow all doctor's orders. Exercise, it can be advised to exercise, but with the doctor's instruction. Patient is not supposed to lift heavy things, and whatever is doing, even if it's an exercise, everything must be done slowly. And it is important for the patient to know what to report immediately into the hospital, especially if the patient develops severe headache. It needs to phone the doctor immediately so that the patient will be back into the hospital to avoid whatever or to go for other tests that can help and assist what may be the cause of that headache. Seizure, if the patient develops seizures, is another complications of brain operations. The patient needs to know that he must report to the hospital immediately. Infection, all those things, it's so important for the patient to be educated even prior to surgery so that she knows what may be the complication that may be associated with craniotomy. And what is important, the patient education, and the patient must work hand in hand with the health providers. For today, we will end up here. Thank you for watching. If you do like these short videos, please subscribe, comment, and share, and ring a notification bell so that if we upload another video, you will be informed immediately. Thank you for support. Till next time, stay safe and stay healthy.